quite interesting. Let's look at the protein response. This is acyl ghrelin and this is total ghrelin. They both respond in exactly the same way, very similar to each other. So if we look at the protein response, which is the open squares, you can see that protein is very effective in following ingestion, in keeping ghrelin, and actually decreasing ghrelin, and keeping it at low levels for 6 hours afterwards. Is this the well-known protein satiety effect? Possibly, yes. Carbohydrate, on the other hand, well, let's do fat next. Fat decreases it, not quite as effectively. It does restore to baseline level in about 3 to 4 hours. And here's carbohydrate. Carbohydrate does decrease it initially, but then in response, ghrelin is increased to a peak about 3 to 4 hours following, and then gradually comes back to normal. And so carbohydrate has a biphasic effect on the ghrelin release. And I call this the candy bar effect. When you're hungry to eat a candy bar, everything's fine for a couple of hours, then you're really hungry. So I think that the interplay between protein and carbohydrate satiety, or lack of satiety, is really important to pay attention to in weight reduction diets. And I think the Atkins study showed that quite well. Okay, but ghrelin, what this is showing you is that ghrelin can be quite readily and significantly manipulated by macronutrient composition of the diet. Okay.